Hi, everybody. I'm Susan Buchanan, faculty here in Environmental and Occupational Health Sciences Division, School of Public Health. I'm also a neighbor of and a bike commuter with Dave Jacobs. He lives down the alley from me in Oak Park with his master gardener wife, Joan. I also direct the EPA ATSDR funded Great Lakes Center for Reproductive and Children's Environmental Health here at in our EOHS division. Dr. Dave Jacobs, research scientist, certified industrial hygienist, and chief scientist at the National Center for Healthy Housing, has worked across the housing, health, and environmental fields for over 40 years. Dr. Jacobs helped design policies and regulations that mobilized concerned U.S. parents and other residents to protect millions of children from lead poisoning. He wrote the report to Congress that launched the U.S. Healthy Housing Initiative in 1999 and testified before the Senate and Congress several times, most recently in 2021. Dave has led studies at UIC on ventilation and gas stoves, dusts from building demolition, and the benefits of green, healthy housing construction. In addition to his certification as an industrial hygienist, he holds degrees in technology and science policy, environmental health, engineering, and political science. All separate degrees? Wow. Today, we are launching his book, 50 Years of Peeling Away the Lead Paint Problem, Saving Our Children's Future with Healthy Housing, which traces the failure of the medical model of treatment after exposure that marked the approach to lead poisoning in the 1970s and 80s, and its replacement with a prevention housing focused effort. It's the first book to examine how the lead poisoning law in the US was passed in 1992 and later implemented, with implications for the future, in particular, the emergence of a healthy housing movement. A warm welcome and congratulations to you, David.
Well, first of all, let me just thank our sponsors, particularly the Henry Howland Trust. I had a great time in Australia. If you ever get a chance to go down there, do so. They're wonderful people, and I really enjoyed it, but it also gave me time to reflect on what we've done. And also thanks to the folks here at UIC for helping to put this great event together. And also, we have two other sponsors, the Metro Tenants Organization. John Bartlett couldn't be here today, but he sends his regard. And also, because part of this book does deal with the legal dimension, we have sponsorship from the Loyola Law School as well. I wrote this book not just to look back, right, or to sit on the shelf. It's really to inform our future. Susan and Susan's dad and my dad were both ministers, and I remember he said, you know, the greatest of all human gifts is that of remembrance. And so we remember, but not just to remember, but to chart our wisdom going forward. So this is what these are my main messages today. I think that lead paint was one of those, unfortunately too rare, but it was truly an example of how science was used to actually inform policy. But policy by itself isn't enough. The policy has to be implemented. And it also helped with that. So parents and community members working with scientists and government officials and others were actually key to creating the political will that made those policies not just on paper, but actually take effect. The book also argues that we now have what I think is a new emerging consensus. And that is that housing is not, or health is not just about communicable versus non-communicable disease. Environment can't just be about the shared commons, and housing can't just be about wealth building. All of those things are actually related to each other, and we ignore the how they are linked at our peril. So I think that what I want to leave you with, and many people said to me, in fact, where is she? One of my students said, you're too optimistic about all this. And so what I want to leave you with is a rather strange policy paralysis paradox, and how I think that the lead paint example and the healthy homes example helped us end that to create real progress. It's only fitting that the book be dedicated to the children. They are the ones who bear the brunt of this, but it's also to the thousands, really the hundreds of thousands of professionals, housing, health, and environmental, who over many years worked tirelessly to protect them. I created a bit of an honor roll, which is always a risky thing at the end of the book because you inevitably leave some people out who should be in there. But I name them because I think what they did was truly heroic over many years. So we've had some success. You've heard from this earlier. Blood lead levels in the US have improved by a great deal, over 93%. And somebody once asked me what an UGDL is. An UGDL, micrograms per deciliter. That's in the States, that's how we measure it. In other countries measure it differently, but it's micrograms per tenth of a liter of blood. So that's an enormous success story. These are data from NHANES, and I guess we don't have a pointer here, but the yellow line is non-Hispanic Blacks going all the way back to 2007. And the blue line is white, and the purple line is Mexican Americans. And you can see that the error bars in the most recent data don't overlap, which means the difference is still statistically significant. It means that there's still an important disparity that while it's less than it used to be, and we are making progress, it's still there. And so not everyone is sharing equally in the progress that we've made. If you go back all the way back to the mid-1970s, when we first started counting children with elevated blood leads, you can see that both the disparities and the population blood leads have declined by dramatic margins. If you look at the left, it's kind of an astonishing thing. In the 70s, almost 100% of Black children in this country had blood lead levels above 10 micrograms per deciliter. And even white children were at 85%. So pretty shocking nowadays. By the same vein, housing units with lead paint have also declined. HUD did a survey in 1990. The estimate then was 64 million housing units. We have a little more than 100 million housing units in this country. It's now down to 35 million. That's still a lot of housing units though. And so we still have a long ways to go. And one of the challenges in the policy world is, some people in the policy world will look at this graph and say, great job, you're done. Case closed, I'm going to move on to something else. So we're not done, and I'm going to explain why. Whoops, wrong way. So where we are today, we still have, by my estimate, nearly 600,000 children who have blood lead levels above the current CDC reference values. We still have disparities by race, ethnicity, income, and housing that still remain with us. And somewhat shockingly, the number of houses with deteriorated lead paint actually increased since over the past several years. So that's because the housing stock is getting older. And so we need to redouble our efforts to make sure that that ongoing aging doesn't continue to poison far too many children. I argue in the book that there have been basically three main phases of lead poisoning prevention. And many people don't realize it, but if you go back to the 50s, life insurance companies actually tracked child fatalities from lead. There were about 200 kids a year who were dying from lead back in those years. So the nation initially adopted, and it makes some sense, a medical triage approach, which was oriented towards looking at prevention of ingestion of lead paint chips. But that was a medical approach, and the housing world was missing in action, as I'll show you in a minute. But that gave way finally in 1992 when Congress passed a housing law, Title 10 of the 1992 Housing and Community Development Act, which was really a public health law, but it mandated certain duties for the first time to housing, health, and in the environmental world specifically. And then since about 2015, this effort was pretty small. It was about building capacity and getting local governments to step up, and also getting the expertise in the private sector where it needed to be. But since 2015, I would suggest that we've expanded our efforts to take the solutions that have finally been proven through the research to scale. And without going to scale, we'll never fully solve this problem. I've had more than a few congressional staffers say to me, we like lead. And I said, really? Why do you like it? And they'd say, well, because there's light at the end of this tunnel. It's a big problem, but we can see the solution there. And so we need to take those solutions, but to scale. And that means getting the money to make it happen. This is EPA's view, the environmental world in 2013. And I ask you, where is housing and where is paint? Now, paint is on here. It's sort of a tiny subset of indoor dust, but the focus is on air, soil, and water, and not so much on paint. So the environmental world historically has tended to ignore the importance of lead in paint. So one view was this, basically. We took lead out of gasoline and also lead in food canning in the 70s and 80s, and the blood lead level came down. So some people say, particularly the environmental world said, those were successes, and again, we're done, right? The problem has been solved. However, this is another view, and I know this slide's a little busy, but this shows why the problem has not really been solved. This is Russ Fliegel's work back in the early 1990s, but he figured out what the so-called natural prehistoric background blood lead level would be. And he came up with the figure of 0.016 micrograms per deciliter. Now, remember, I told you the average nowadays is about 1, a little less than 1. So the point is, the current exposures today are still 100 times larger than where our ancestors were. And mind you, we haven't figured out what a so-called safe dose is for lead, at least yet. So we have a long ways to go, is my message here, and we still need to take further action. Now, the lead industry seized on this business of which source is more important, and they basically argued, yeah, it's somebody's lead, but it's definitely not ours, meaning the lead paint industry. It's somebody else's. And I debated this guy, John Weaver, back in the, I guess it was the late 80s. But the lead industry basically said it's gasoline, it's food, it's bad landlords, it's parents, and some of them even tried to blame children themselves for not behaving properly or eating things they shouldn't eat. So this guy, John Weaver, I was on a panel with him once, and he basically blamed the moms. He said, what we need to do more than anything else is clean, right? Cleanliness is next to godliness. It was practiced by those legendary Dutch housewives of old who scrubbed their homes, and that's needed more than anything else. And they still argue that today, by the way. I had a great time on that debate, you can imagine. They put out this coloring book, by the way. This is the Dutch Boys coloring book that is now a label that's owned by, I think it's the Lead Industries Association or maybe Sherwin-Williams. But the data finally accumulated. N. Haynes didn't really report age of housing until the late 80s and early 90s. And this is what you see. So if you look on the left side of this bar, back then, this is the early 90s, about 5% of kids had a blood lead above 10. If you go to the older housing stock where lead paint's more prevalent, it jumps up to 9%. If you're in the low-income housing world, it jumps up to 16%. And for African-American children living in such homes, it climbs to an astonishing 22%. So clearly a housing-related epidemic in anybody's book. Over the years, the CDC did lower these blood lead trigger levels. Astonishingly, the Surgeon General in 1971 declared that 80 micrograms was an unequivocal case of lead poisoning. Now, mind you, the fatal dose is somewhere between 100 to 150. So we're right up there at the fatal dose. And a lot of that was due to inability to measure, as you heard from the commissioner and others. We're now down to 3.5 micrograms per deciliter. So this has been one form of progress, but I would caution you that most of these guidelines are they're focused on medical management. And for many years, the housing world did not participate in the CDC committees that drafted these things. It was toxicologists and physicians. So Donna Shalala, who was a secretary of the Health and Human Services Department at the Fed, she was the one who swore me into the federal service when I went into HUD in 1995. But before that, she had served in President Carter's administration. And so I asked her when she swore me in, how come HUD didn't do more about lead paint in the 70s and 80s? And this is what she said. The scientists told us it was all about gasoline. She said, now we were clearly wrong about that, but that's what we were told. So again, the importance of getting the science right. Furthermore, EPA and Food and Drug Administration in the 70s thought that food was actually the main problem. In fact, the reason we started counting lead poisoned kids in this country was because of lead solder in baby formula cans, if you can believe that. Now, of course, the canning industry said it's on the outside of the cans, it's not getting into the milk, which of course was nonsense. So I'm not saying food is not a problem or that gasoline's not a problem, but both of them kind of missed the main focus, which really it should have been on paint. And as Dr. Shalala, who went on to co-chair the president's task force, which I'll talk about later, she finally realized that, yes, we need to pay more attention to paint. In the early 90s, HUD, EPA, and CDC were each doing their own thing. They each issued their own strategic plans. And Don Ryan, who writes the introduction to the book, he was a key congressional staffer on the powerful House Banking Committee. But he basically said there, no one in the key offices at EPA or HUD could name a single person at the other agency when I asked him in 1988. They were lead paint had fallen through the cracks and they were doing finger pointing. Now, the result of that was predictable, right? There were no standards in place. So most poisoned children actually did not go to court, but a few did. And periodically, one of them would get a so-called jackpot award. There was one in Baltimore that was worth over $6 million for a single case of lead poisoning. In the affordable housing world, that struck fear into landlords' hearts. They didn't really know what to do with this. Does lead poisoning prevention, does it come out of my capital improvement budget or my maintenance budget or something else? And the public health world didn't understand how those two budgets work. So the lack of standards really drove this sort of runaway litigation engine. And it finally drove home to decision makers that the 1971 Lead Paint Poisoning Prevention Act had failed, because it basically gave the main duty to solving this problem to clinicians who did the very best they could, but they didn't really, doctors are not trained in how housing works, and housing providers are not trained in how to interpret blood lead data. So again, ships passing in the night, and it would really take both of them with a more integrated approach to make progress. That act basically said it was the presence of lead in paint that was the problem. So if you have a problem in your house, what's your immediate response? Most likely going to be, get it out of there as fast as possible. So the left is some of my first studies in the late 80s in a public housing development. And these are great ways to remove lead paint. It's really fast, open flame burning and power sanding. But of course, that creates dust. Now, these guys have some, you see some personal protection, some respirators, but more often than not is what was going on in Baltimore. This is Mark Farfell's pictures from Johns Hopkins, where the guy's using a blowtorch to melt off lead paint, but there's no protection for him at all. So what we found was not only were the workers getting exposed, but the children who moved into these units also were getting overexposed because we couldn't get the housing cleaned up adequately after these high dust producing methods. So research finally banned these practices. They're prohibited across the country, but it wasn't until the exposures were measured and documented for both workers and children that it became clear why they were dangerous and why other methods that minimize those had to be replaced. So in summary then, to this early part, this was the perfect storm. Public health was basically focused on blood lead screening and medical management in a desperate attempt to save children from dying through chelation and others. The housing world couldn't figure out how to put health into their operating budgets because they didn't get any benefit in the value of the home if they made such an investment. And the environmental world remained focused on gasoline, water, and in certain industrial releases. So some of you who are, occupational health things, you know this hierarchy of controls. And if we had, and I wanted to give a special salute to the Australians because the first diagnosis of lead paint poisoning actually occurred in 1895 in Brisbane, Australia, by an ophthalmologist of all people. And his colleagues at the time ridiculed him, saying, well, the lead's in the binder and the paint, it can't get into the children's blood. They kept publishing their data saying, no, it really is a paint problem. And the evidence accumulated so that by 1920, the International Labour Organization passed a treaty that most of the industrialized world signed onto that banned the use of lead in residential paint. The US didn't do that. We didn't ban lead in residential paint until 1978. The results were predictable. So I try to apply this hierarchy of controls. Obviously, if we had banned it before it became widespread, that would have been the smart thing to do. But we didn't do that. And frankly, nobody really knows how well that old treaty was actually informed. But again, I want to point out the occupational health profession through the International Labor Organization played a key role in doing this. They passed this ban ostensibly to protect workers, but everyone clearly knew that children were also a key area. So we still face this, what I think is a fundamental problem in how we do research. At last count in 2014, the National Toxicology Program said there were, and I'm sure there's over 30,000 now, studies that look at lead toxicity, and lead's bad for you. We get that. So it's, and we keep measuring it, but there's less than 50 studies on solutions. You know, how do you actually remediate this lead paint safely in a way that doesn't create more harm than good? So I think we, as a country, we need to do better to figure out how we research solutions and interventions that show promise. So part 2 of the book is, so that's sort of my doom and gloom part of the book, right? There's part 2 talks about how some of the success started to emerge. So those were involved with pathway studies. How exactly was the lead in the paint getting into children's blood? Again, as I said, the early acts that Congress passed focused, they defined a lead paint hazard by the amount of lead that was present in the paint. And that was actually enshrined in a court case, Ashton versus Pierce. Sam Pierce was the HUD secretary at that time. But the Supreme Court basically said a lead paint hazard is lead paint above 1%, later to become 0.06. So no concept of dust, no concept of how the exposures really occurred. This is a radiograph of the child's abdomen, and you know, lead's radio opaque, so you can see the white chips that show up. And so for a long time, most people thought this is how children are getting exposed. They're eating paint chips and the like. So by 1988, though, these pathway studies had become clearer. And so the Agency for Toxic Substances and Disease Registry was ordered by Congress to rank the different sorts of exposures that were going on. And for the first time, you see that lead paint chips, lead paint chips, dust, and soil was the number 1. Now, this was not an easy report to get out. By the way, the report said, and it's pretty astonishing for a report to Congress to say this, lead paint has remained an untouched and enormously serious problem. Corrective actions have been a clear failure. The fellow who wrote that report, Paul Mushak, one of the nation's leading lead toxicologists, he publicly resigned from the Public Health Service because he was worried that the report, and it would have been, watered down. So this was a quote in the Washington Post in 1988. He basically said, and I had the pleasure of meeting him, he's passed away now, but he said, no way in hell can you comprehend how complex this problem is in a boiled down, misleading, and essentially neutral document. So he's really one of the heroes that the book celebrates. He stood up and said, these are the facts. And some of you are public health students. If I leave you with nothing else today, that should be your what you take away here. We got to stand up. The facts still matter. The facts are under attack. But if you point to the facts consistently and hammer away at it, progress is indeed possible and more likely. Now, lead paint risk assessments were born in the public housing world. Public housing in this country was sort of one of the first classes of housing to go on the chopping block, so to speak. Congress had ordered all the housing authorities to inspect their family housing developments, which they did. So they had knowledge of where the lead paint was, but they had no money to remediate it until that development came up for what's called comprehensive modernization, which could be 10, 20, even 30 years down the road. So what some housing authorities did was band together and said, we're going to insure this risk, just like any other risk. We're going to develop a risk assessment protocol, which they asked me to develop back when I was at Georgia Tech. And it was 2 fellows who knew how public housing authorities worked. They said, if we have evidence that's scientifically based, where the immediate hazards are and where the long-term hazards are, then we can chart a way forward for public housing to come to grips with it. So they insured the risk. And basically it proved to be very popular, but nowadays we have the routine practice that the commissioner talked about how do you find out what the particular source is in a given housing development. But that protocol was born because of an insurance issue. It was because the risk was perceived not to be manageable or solvable and then insurable. But we were able to do that. And it was really Miles and Gordon who were key in doing that. These were both guys who had taken over troubled housing authorities for many decades. They knew how housing authorities worked and how they didn't. And so they were able to do that. they asked me to write a white paper on the New Orleans Housing Authority back in the late 80s, which I did. There were hundreds of poisoned children in several housing developments right there. And I still remember, so Barbara Mikulski and Kit Bond. Kit Bond was a conservative Missouri congressman, and Barbara Mikulski was a liberal firebrand senator from Maryland. But I still remember this hearing. They had two witnesses at the hearing. One was the policy guy from HUD, and the other guy was the public housing assistant secretary. And they both pointed the fingers at each other. The policy guy said, this is a public housing problem, so it's his issue. And the public housing guy said, no, this is a policy problem. It's not really a public housing. So Mikulski and Bond both reacted in fury and said, you know what? We don't want this finger pointing. We want a single office created within the immediate office of the HUD secretary, which was pretty unusual, especially for a public health problem like this. So that office was created. It still exists there, but it really took a scandal to do it. And I think it was Peter Phibbs from Australia, who I think he told me one time, never let a good disaster go to waste. Unfortunately, sometimes it takes that. In the early 90s, there were two nonprofits that emerged. One was called the Alliance to End Childhood Lead Poisoning. They were focused on advocacy. They conducted the first national conference on childhood lead poisoning prevention in '91. And at that conference, the Secretary of Health and Human Services, Dr. Louis Sullivan, basically declared lead poisoning to be the #1 environmental health threat to the children in the US. They also inspired this cover of Newsweek magazine, and all that led to important congressional hearings and ultimately the passage of a new, what I think was an informed law. The National Center for Lead Safe Housing later became the National Center for Healthy Housing. That's my group now, and it was originally formed in 1992. So finally, Congress acted on the new pathway science. They redefined what a lead paint hazard was. The book explains how it was passed, how industry opposition was overcome. It created new mandates for the private world to, before this law was passed, it was actually legal for a landlord to conceal information they had about lead problems in their home before they rented it. After this law was passed, that became illegal. The law charged EPA with setting new dust standards. For the first time, it regulated not just long-term abatement, but also interim controls. Again, walking on two legs, a short-term approach and a long-term approach that makes sense. And it took a housing law like this to finally order OSHA to protect construction workers from lead. The original lead standard was passed in 1978, but it was only for industrial workers. So the folks who were doing lead paint abatement, their construction, they weren't covered at all by the OSHA law. So this law ordered them to do that. And perhaps most importantly, it authorized funding for privately owned low-income housing, which is really where the risks are most severe. HUD was not a scientific agency. In fact, it really still isn't. But it was Henry Cisneros, who was secretary under President Clinton, and Bruce Katz, who had previously been a congressional staffer who was the architect of Title X. And he was now chief of staff at HUD. And they realized that HUD was not working. There were growing pains. The local governments were not able to spend the money. There were congressional hearings where, congressmen would go after HUD and say, we gave you guys several $100 million. None of it has been spent 3 years later. What's the problem here? Let's go on. So they realized HUD wasn't working. And in 1995, Congress actually withdrew all the lead paint funding because they said the money's not getting spent. A year later, after HUD had made some changes, the funding had been restored. There was emerging confidence that we could build capacity, and we actually knew what it was. But it wasn't until HUD brought on its own scientific capacity to break the logjam. That was reflected in guidelines, which I lost a lot of sleep over writing. It was over 1,000 pages, but don't worry, each chapter has a 2-page summary, so you don't have to read the whole thing. But basically, this was about translating that exposure science into practice so that construction people could actually implement and inspectors could implement the science. If we didn't translate it, it would have been harder for them to do that. We had both short and long-term remediation. The book explains how we created the dust standards. There was this, some people wanted me to take it out of the book, but I said, this book is about science and you got to understand they're doing between empirical modeling and mechanistic modeling, which I won't bore you with now. Also, there was an evaluation of the HUD Lead Hazard Control Grant Program, which to this day remains the largest such study that's ever been done. It covered 3,000 housing units in 14 jurisdictions across the country, but it showed the new methods, not just blowtorching and power sanding, but the new remediation methods actually worked. We saw massive declines in blood lead levels, as well as massive declines in dust lead levels. Again, all 14 jurisdictions typically had occupational health professionals in key leading roles that helped create the scientific basis. So this was some of the research work. We weren't sure what the right dust collection method was to be done. So the book explains the pros and cons of each and how decisions were made to basically use a rather simple but method, wipe sampling, which you see in the bottom here, but is also the one that most highly predicts blood lead level in children. So this law also required that for the first time, all federal housing laws be reformed to reflect the new science. I came into HUD in '95. We proposed the rule a year later. It got finalized 3 years later, and then it took another 2 years to get all the housing providers regulated by HUD. So I explained why it took a decade, how we had to overcome resistance, not just from the lead industry, but also from the housing world as well. There was rampant uncertainty about how we could measure what we were doing accurately. The book also recounts some stories of political sabotage. It was Andrew Cuomo was HUD secretary back in those days. And he got cold feet at the end there and said, you know what, I think I'm going to pull this law back. Some of you know, he later went on to become a disgraced governor of New York and was forced to resign. But he was, he almost withdrew the law, this proposed regulation as well. That was overcome by another inspired person, Sean Donovan, who would later become a HUD secretary himself, to basically say, I think we can figure out a deal here that would make both sides happy. And without his involvement, we wouldn't have been able to push back on Andrew's issue, which the book goes into more detail about. We also launched new enforcement efforts. This was the first time that the disclosure law had been enforced. I'm really a public health housing person. I'm not really an enforcement guy. So I realized, and I tried to figure out, well, how are we going to enforce this new law? It was a joint EPA HUD rule, which made it even harder to enforce. But I finally realized, you know, we should go to the Department of Justice. These are the guys who know how to do this. And one of the lawyers there basically said, you know, this is why I went to law school. It was not to write arcane legal decisions, but to actually create laws that make sense and to enforce them. And so they were very helpful. We put this guy in jail for 2 years, not just because he violated the disclosure law, but because he lied to us. And we didn't like that. This was an award ceremony that we got at the Department of Justice with some of their lawyers. You see Janet Reno, who was DOJ Attorney General back then, and Eric Holder, who later became Attorney General himself. But without having the lawyers involved, I don't think we would have made the progress on this. So by the end of the 90s, we had the scientific capacity at HUD. We had improved management practices there. Congress had recognized the increased capacity so that they could provide more funding. The scientific basis for what the lead dust standard should be to protect kids and could be measurable was finally created. We created new evidence through the evaluation study that these methods were in fact really working. All the regs had been reformed for federally assisted housing. There were new measurement methods. There was also a large public education effort, which I'll describe in a moment. And we had both subsidy and enforcement for classes of housing for which the market doesn't work. So you're left with kind of looking at improved subsidy and also enforcing the law. This book for the first time tells the story of parents. And I want to salute Maura Jackson and her daughter. They played key roles. Yeah, so her daughter had suffered from lead poisoning, and Marcy Jackson, who was her daughter and your mom, was one of the nation's best advocates of why this issue mattered. I mean, I've testified before Congress a number of times, and I can get up there and cite the statistics and why this matters and all that. But when a mom gets up and basically told the Congress I didn't need help from the health department to tell me to wash my kids' hands better and feed them better. I needed help getting my house fixed. That resonated. You could hear a pin drop in that room. So the story of parents is told in this book. We created the campaign for a Lead Safe America. There was a group called United Parents Against Lead, which still exists in a number of cities. And so I tried to document their stories, their creativity, and how they collaborated with scientists to create the all-important political will. This is Marcy, your daughter, and Ann Evans, who's an adjunct here. She used to be the director of the Chicago lead poisoning program. She's now, what is it, Elevate Energy, I think it is. But she basically said that Marcy was essential as a lead poisoning advocate in Chicago, and I would add nationwide. She was on a number of federal task force that I was on. She was really key in empowering parents to help their children, but also in giving parents a voice in setting the agenda in organizations that set policy. So we got to hook up with a number of them. We met up during the pandemic, actually, with in a where was it, a coffee shop somewhere. And this is another one, Leanne Howell. She would come to various lead conferences dressed up as Lady Gaga. She had these hand puppets with the Dutch boy, and she was great. She also was very articulate. Her own child had been severely poisoned. She actually has her own book coming out shortly to tell the story of her child. Margaret Sauser addressed a White House press conference. She was a founder of the United Parents Against Lead, and the book tells her story and the power of that particular White House conference. And again, the role that Andrew Cuomo and others played in sabotaging that particular public health effort. In 2001, for the first time, all the federal agencies finally got together and said, we need to have one unified strategic plan to deal with this issue. And this was at the cabinet level. The nation has been without this task force since about 2009, I guess it is. So we finally had a single plan and an interagency budget request. We currently have an interagency plan on the books now that was done under the Trump administration, but you know what the second line of that plan says? This is not a budget document. So without the money, nothing's going to really happen. So we proposed an audacious goal to eliminate this problem by 2010. And basically that plan was bipartisan because it was HUD Secretary Mel Martinez, who was the first housing secretary under President George Bush. He made lead paint in HUD a priority for the first time, and he put record funding behind it. But I also talk about why that plan failed. It's basically you get what you pay for in this world. And so Congress never fully appropriated the cost estimates that we provided in the plan. Had they done so, I might not be up here today. But unfortunately, we're still talking about this because the investments have not yet been made. And I'll talk about some of the hopeful signs of how federal appropriations have actually increased in recent years, because I think people now finally get it. There were two attacks that occurred in the aughts and the 2012. In 2004, HUD Secretary Jackson, Alfonso Jackson, attacked the lead program, and he basically parroted the industry line. I'm not making this up, but he basically said in a press release, if we educate young mothers before their child ends up in an emergency room, then we've done our job. Again, it's mom's fault, right? We just have to educate them and we're done. In 2012, Tom Frieden, who was then the CDC director, thought that, well, we should combine the asthma and the lead programs into one at CDC and cut the funding in half. There were some other political shenanigans going on. At the end of the day, the lead budget basically got wiped out. So both of these things created national protests. I document how those protests occurred and so forth. So where is it? Well, and so there were basically efforts to repudiate these attacks, and they worked. There was out of that struggle came the National Safe and Healthy Housing Coalition, a group of now 600 organizations across the country that makes sure that Congress is fully informed of what's going on. Is that good public health practice? You think we put kids in respirators? Anyway. Now, I've talked a little bit about the legislative branch and the executive branch, but where were the courts? So basically, the legislative branch had passed Title X and some larger budgets. The executive branch had reformed some of the regulations and adopted this new plan. But the courts were still, in my view, continued to get it wrong with some notable exceptions to the problem, to solving the problem. The courts have been unable to grasp the scientific evidence. I served as an expert witness on a number of cases to try and make the evidence clear, but it's still a challenge. And so one of the wrong-headed decisions, what's known as the Grimes decision. This was sort of a study known as the Baltimore Lead Paint Abatement Repair and Maintenance Study, R&M for short. The lawsuit was basically a child alleged that researchers had experimented on Black children. That was actually not true. And initially the court rejected that argument by saying the researchers at Hopkins were like good Samaritans, and they dismissed the lawsuit. But the Maryland Court of Appeals, the highest court in the state, basically overturned the lower court verdict without facts and evidence. And it basically said the researchers were experimenting, and it basically compared this study to the notorious Tuskegee and Nazi research. And I remember Mark Farfel was the PI on that, and he said, look, I'm Jewish. Do you know what it's like to be compared to Dr. Mengele? So I tell this case through a lens of environmental justice and what the actual facts were. There were some key legal issues, which I think in the interest of time, I do want to have time for a discussion here at the end, but the legal issues were about therapeutic versus non-therapeutic research. The idea was therapeutic research is sort of pills, right, and drugs, and non-therapeutic is other things like communicable or non-communicable disease. I tried to argue once at CDC, in this case, housing is what's communicating disease. So lead poisoning is a communicable disease. And they shouted me down. Commissioner Smiley. The court also said, there's no existing regulations that protect human subjects. That was obviously wrong, but they thought they were ruling on new ground. They had no understanding of how lead dust measurements were actually done. They thought there were problems with the informed consent. They actually at one point said parents do not have the right to enroll their children in studies like this. They later withdrew that because it would have shut down all vaccine and other child-focused research. They were ignorant of human research protection regulations, and the Office of Human Health Research Protection did investigate this particular study and basically found no significant violations. One of the last things I did before I left HUD in 2006 was commission this National Academy of Sciences report, because a lot of us scratched our head and said, well, is there something about housing intervention research that is not adequately protecting in an ethical way the rights of the participants? And so the Academy took a long look at this and basically rejected this idea that therapeutic and non-therapeutic research are somehow in these two different worlds, and there the twain shall meet. So it basically adopted a risk-based approach, which had actually been around since the 80s. It also highlighted the importance of community participation in research, not just in carrying it out, but also figuring out what the goals of the research. And it also looked at the evidence. Now, of course, the Academy is not a group of lawyers, so it's not really a legal document, but I think it's still worth reading. It remains the major work on this particular issue today. At the end of the day, the Washington Post had this view of the study. It didn't come within a country mile of ethical lapses. It was not at all like the horrendous abuses of Tuskegee or the Nazi concentration camp at Buchenwald. Far more offensive is the social indifference that has led generations of children suffer the insidious menace of lead poisoning. And then the kicker, if a judge's irresponsible comments can somehow impair helpful research in this area or mire it in opportunistic lawsuits, that will be the moral outrage. No other lawsuit happened like this in any other jurisdiction. And this book basically shows how the juries actually rule. And in every case, after the facts were presented, this initial decision had been made without facts and evidence. Courts can reach decisions without facts and evidence based on principles. But the point of this story is if you ignore the facts and ignore the context completely, you end up with disastrous decisions. So the juries actually ruled in favor of the researchers once they heard the facts. So this idea that somehow the research was unethical was rejected. The researchers, some people thought they were negligent for not complying with the existing regs. The facts showed that wasn't true. The court's attempt to deny children the right to participate, that was rejected. And all the researchers were found to not be negligent with regard to the study participants. So an important milestone in this in the will. Now, the appeals court decision in this case did have real impact. One of the Baltimore's key low-income housing providers, City Homes, went into bankruptcy because of the lawsuits. And that gap has not really been filled since then. Mark Farfel went on to lead some of the other nation's most important health studies, notably the 9/11 disease registry out of New York. But he was really unable to continue to work on lead poisoning. He was the guy who, more than anyone else, got the research in place so that we could ban these dangerous practices. It was his work, and his predecessors were J. Julian Chisholm, who, by the way, invented the blood lead test. That was key. So today, law students are taught this, and I basically cite a case study brief, but the point of how this is taught in law schools is they never actually get to the jury verdict. How did the juries actually rule? What were the facts? Instead, we got this arcane legal decision that somehow in non-therapeutic studies, these informed consent agreements can constitute special contracts. So this book reports how that court decision was wrong and how it was finally turned out. Now, some courts, however, I think did get it right. In Rhode Island and California, a number of local jurisdictions brought suit that finally held the lead paint and pigment and lead industries accountable for the first time. And the book explains the difference between public nuisance and product liability law. The Rhode Island jury ruled that the industry should pay for remediation. The Supreme Court overturned that jury verdict, and the book explains why. But in some ways, it was because the remediation plan had not been presented to the court at trial. That was changed in the 2014 lawsuit, where the California judge looked at the abatement plan and looked at the history and basically said, yes, the industry should pay or should help pay. The Judge Kleinberg's quote here is blaming the well-worn stereotypes of slum landlords or bad parents or the poor or the government does not relieve the industry of liability. I was the guy who wrote that abatement plan for California, but I remember the lawyer's closing argument, Fidelma Fitzpatrick. She said, look, your mom taught you this. If you make a mess, you have to clean it up. And that's what he basically said the lead industry should finally do. So that work is now proceeding. There is a secret memo that surfaced in this particular case. This was an internal memo from Sherwin-Williams. I won't take the time to quote it here, but the point is they knew what they were doing. They knew their product was dangerous. They continued to make it for decades. And in fact, and most people don't know this, they continue to make it in other countries where there are laws that don't exactly prohibit it. The UN and the World Health Organization are both leading the charge to put a stop to that. But one of the reforms we need to do in a new Title 10 would be to stop US corporations from making lead paint in other countries. Okay, so part 3 is this new consensus, and I'll close shortly, but basically these protests I mentioned earlier restored the funding for both CDC and HUD. The new national coalition was formed. We had the California and Rhode Island cases to finally make it clear that it's not just taxpayers who have to pay for this, but it should also be the industry as well. And we finally saw the understanding that it doesn't really make sense to think about just going in and fixing a lead hazard, as the commissioner said earlier, and not deal with, a bad smoke alarm or an electrical problem or a fall hazard and the like. So the healthy housing movement rose at the end of the 90s. So what happened was in the wake of these lawsuits and some of the confusion, the funding at HUD declined from 2014 to about 2014. And then CDC, as you can see here in 2012 and 2013, the funding was wiped out for the most part, but then it was restored. And that happened because of this. These coalitions, this powerful group of people got together and basically said, we're going to declare that this is wrong. This is not where we want our political leadership to go. We demand that these programs be fully funded. And over time, that worked. So this is the more recent appropriations data. And you can see that the budgets at CDC and HUD, to a lesser extent at EPA, but they have dramatically risen. And so we're now somewhere over $400 million, far more than what we had estimated in 2000 for the president's task force. So this is finally taking off, and I think it's a reflection of the idea that, yes, we need to invest in our housing. You can pay me now or pay me later, right? If you don't make the investment in housing, then we'll pay health departments and medical health providers to track poisoned kids and treat them after they've already been exposed. That just makes no sense. Make the investment up front, improve our housing stock, and reap the benefits in healthcare and education and other sectors. So the coalition organized these things called Hill Days. The guy in the red tie in the middle, he's a congressional staffer. These are the guys who actually get the work done. But we would take moms and doctors, and the mayor's representative is the woman on the your right. And then we also brought physicians and community advocates so that Congress members could understand the importance of this issue and why it matters and why it should be fully funded. So in 1999, we sent a report to HUD about expanding the lead poisoning prevention program. 2009, the Surgeon General issued a call to action on healthy homes. And as mentioned earlier, the WHO finally issued its own housing and health guidelines, which we were told, by the way, was the first time WHO had issued what they call an intersectoral guidance, which is kind of astonishing to me. That was another tragedy, that healthy homes movement. This was, I was actually testifying before a congressman from Cleveland. And he basically said, we have infants who died in Cleveland, about 20 of them, we think from mold. What is HUD doing about that? And at the time I said something like, it was stupid, but I said, well, HUD has authority to deal with lead paint, but not really with mold. And he said, look, this is the appropriations committee. Here's $10 million. Go figure out what happened in Cleveland. So we did that. And we basically found that in the homes of each child where there had been a fatality, it had the ventilation system that you see on the left. This was basically an open circuit where the basement air was used as supply air for the air handler. The solution was pretty straightforward. Either pipe in outdoor air or from the living area, and then not use basement air as a supply air for the air handler. And of course, remediate the mold in the basement. The reason there was mold in the basement, that part of Cleveland had flooded in recent years. And so we saw this was kind of the first press thing about the black toxic mold that you hear so much about. And so these were the key players. Dr. Dor Dearborn on the left was a pulmonary pediatrician. He and others did autopsies on the infants who had died. And he said, there's lesions in the lungs that were not consistent with their initial diagnosis, which was SIDS, sudden infant death syndrome. So he said, there's something else going on here. Terry Allen, who was the health commissioner in Cuyahoga County, the county health department, he was the guy who said, let's go look at their houses and see if we can find a common thread here. And so we did that. Congressman Stokes in the middle there was the guy who had initially made this investment in mold, and out of that came the nation's healthy housing effort. So in the book, I argue that these three concepts in health, housing, and environment are now tired and worn out. We can't continue anymore just looking at communicable and non-communicable diseases and have most of the money go to communicable diseases. It's that construct just doesn't make sense. If you think about our COVID response, it wasn't just the vaccine, was it? There were lots of other things that we had to do as well. The shared commons thing usually does not, the definition of shared commons doesn't include housing because it's privately owned. So that's wrong. And the housing world continues to be focused on, housing ownership, home ownership, and wealth creation. So I argue in the book that housing can communicate disease. We just saw a bill in the last term of Congress called Housing is Infrastructure. Now, the other party basically decided, no, that's not infrastructure. We're talking about roads and electrical grids and the like. And by the way, I think that's probably why the lead water pipes got funded, because it's perceived to be part of our infrastructure. But paint, it's sort of up to each homeowner to figure out what to do about their home. So I argue that the social determinants of health framework makes a lot more sense. than these old, tired, worn out ideas. So in conclusion, I think this is again a story of how science and citizen action can triumph and end what I call, I think it's a pretty strange policy paralysis paradox. I think, and I'll say what that is in just a moment, but I think there are 9 key lessons. You got to have the research. You have to translate the research into guidelines so that people can use the research. We need those guidelines to become legislation so that they carry the force of law. There has to be public education and advocacy so that people understand why this issue is important. We do need strategic plans so that agencies get particularly clear directives on what piece they're supposed to do. We also, it's not just a government-only solution. Markets have to be transformed so that the housing market correctly monetizes a health investment. Right now, if you do lead abatement in a home or asthma mitigation, the price of the house doesn't go up. And that makes it unlike any other housing improvement. So it kind of, the market isn't working, and it's called an externality, but we need to figure out a way to harness the market forces. And I think that's probably by reforming the disclosure law. And then subsidy and enforcement are still needed. We need to make sure that what we're doing actually works. So that's why evaluation of these remediation measures is important. And perhaps the most important thing is primary prevention. We don't wait for kids to get an elevated blood lead. I mean, we should still obviously do that, but if that's all we do, then we're going to basically be chasing kids who have already been poisoned and then oftentimes sending them back into the same home. I testified before Senator Jack Reed of Rhode Island once, and he said, look, I have a HUD subsidized house in Rhode Island that's poisoned, not 1, not 2, but 5 different children. What is HUD going to do to make sure that a 6th child moving into that home isn't also poisoned? And of course, many times, all too often, they move the child out of the home. So we have pretty good surveillance for kids, although some would argue with that. And then, but we don't really do any surveillance on housing. And so that new house, then becomes available to a new child who can be subsequently poisoned. Did any of you go to the March for Science? I was actually surprised that we have to march for science these days, but we were marching down the street. The chant was something like, what do you want? What do you want? Peer review. How nerdy is that? But anyway, the book has other features in it. I talk about the importance of paying attention to the science. I have donated my papers to the UIC School of Public Health so that I'm not really a historian. So my hope is other historians will take a look at the papers and figure out what needs to be done. And then I also try to name several hundred folks who I think played key roles in this effort over the past few decades. This paradox is pretty strange. And over the years, some people have said, this problem doesn't really exist at all, right? We took lead out of paint in 1978, so we're done. And other people would say, well, wait a minute, there are still millions of housing units with lead paint. The problem is too big. So both of those things create the same product. They create paralysis. And so I think lead paint is a case study in how we can overcome that paralysis. You pay attention to the facts, you figure out what the problems really are, and solutions exist. So if you think about it, some people denied COVID existed, right? We saw where that got us. Some people deny that climate change exists, and we saw where that got us. So there are solutions to this, and that's the closing to the book. I quote Franklin Roosevelt, the president in 1941, at another time of crisis in our nation. We were about to enter World War II. And he basically said this: a nation must believe in 3 things. It must believe in the past, it must believe in the future, and above all, it should believe in the capacity of its own people to learn from the past so that they gain in judgment in creating their own future. So I think that's exactly right. We can fix this. To read a little bit more from the conclusion, lead poisoning is ugly. It robs us of our most precious gift, our future and our children. The story of lead paint poisoning, I believe, prevention is full of hope. It's full of people who actually cared, who had the right skills and expertise, who took some chances along the way, who empowered citizens to act and to tell their stories, and people who listened to those stories carefully, and who established enlightened, practical, and scientifically validated policies, and who succeeded in fighting for the money and the other resources to make real progress and putting policy into real practice. And more importantly, those people have to be in key positions of power at the right time to make progress. Lots of acknowledgements here. I won't dwell on this, but I had a lot of help writing the book. So thank you again to the Henry Howland Trust. I had I'm not sure I ever would have gotten around to doing this if I hadn't been given the time to reflect on where we had been. And by the way, I don't go back 50 years. I only go back about 30. But many others are named here as well. And again, those are the sponsors. So I hope we have some time for questions and comments, and look forward to what you all think we can do. And I hope that the book will help instruct where we need to go in the future. So that's what I got for you. This is where you can find me. So thank you.
So I just wanted to know if you have any comments on how this plays out in other things that we have less ability to monitor.
Okay, so the question is basically, we have a blood lead measurement as a biomarker of exposure, although we didn't always have that, frankly. There were other efforts in the earlier years to look at other factors and clinical manifestations. But I think the biomonitoring thing cuts both ways, because on the one hand, people would rely only on blood lead to determine whether the remediation was working. Now, of course, blood lead integrates all sources of exposure. So even if we removed all housing-based sources of exposure, the blood leads might not come down. And that's actually what we saw. You know, dust lead levels declined by 90%. The blood leads only came down by 38%, which is still a huge improvement. So I think it's been helpful over the years, but I think we also need to have good markers for housing quality as well. So there are, new housing, healthy housing inspection protocols that don't just rely on biomarkers. But I think you're right. Without that, we might never have been able to shine the light brightly on why this was a problem. Because at the end of the day, most lead poisoning is asymptomatic, at least today. And so it's not going to be observable to a clinician in a clinic without the blood lead test. So I think you're right. That was a key thing. The book does tell a little bit of the story of how the blood lead test came into being and how it replaced some earlier biomarkers. But it's a good point. Yeah, Sam.
Congratulations on the book, and thank you so much for the lecture. I think the only problem is that you're too modest, and you talk about the honor roll, but you have stood up for what's right for public health in so many circumstances. And even though you acknowledge all kinds of other people, there's a whole lot more that you could be saying about what you've done. One of my favorite stories is you showing up to a Sherwin-Williams shareholder meeting and throwing it at their face that they continue to produce lead-based paint that they sell around the world, even if they're not selling it in the US. But I think that we here at the School of Public Health are really fortunate for you to be a member of our division and to share your experience with faculty, staff, students, communities. So thank you so much.
Well, thank you, Sam. I didn't pay him for that, by the way. But some people thought this should be a memoir. And I said, no, it's not really just about me. It's really, it was a group effort, thousands of people. So I am part of the story, you're right, but maybe I'll do that some other time. Do we have something online or any other comments or?
Question from online. Since we know lead affects all children, does it make sense to continue to only fund remediation for households sitting below the 80% median income levels? Think of the family of 5 who 2 public school teachers for parents. If they make $120K per year, replacing lead painted windows isn't in the budget.
Right. So this is one of my ancillary slides, but that the Title 10 law, as much as I'm an admirer of it, it's now 30 years old. And there are some things in it that don't work, like the income requirement, for example. I think that it's time to expand that. You're right. Lead remediation, it is expensive. and it is out of the reach of ordinary Americans for the most part. So that needs to be fixed. And these are some of the other reforms that we probably won't go into in detail here, but I'd hope to have a paper out, but it will be out shortly, which I co-authored with Mary Jean Brown, who used to run the CDC program, but it outlines what I think the key reforms are for Title X. So one of them is the income guidelines. One of them is also, right now, I think we learned this in COVID, we can't just rely only on local governments to funnel the money. It has to be nonprofits and others as well. Otherwise, we end up with a bottleneck. The other key thing quickly is most houses in this country remain uninspected. We don't know exactly where the lead paint is in any given home. And so therefore, it's still, until that is fixed. And by the way, the original version of the disclosure law introduced by Congressman Henry Waxman would have required a lead inspection at turnover or sale, so that new buyers could get in, they could have an idea of what they're getting into. After all, if you think about it, what's the best time to finance a fix for a problem in a home? It's when it goes up for sale, or even lease, arguably. That's how the housing world actually works. They finance these things at that time. They have physical needs assessments. So because the real estate industry fought back and watered down the disclosure law, right now it basically says hand out his pamphlet at a lease or a new sale. And then most of the time, the owners can check the box that says, I don't know whether there's a known lead hazard here or not. So that needs to be fixed. And we should, now in the 90s, that wasn't in the cards, but I think home inspections are more common nowadays, right? And it shouldn't be that heavy a lift to say, just like we inspect for other hazards, let's inspect for lead at the time of sale. So there are some other issues as well that I think needs to be reformed. You mentioned Sherwin-Williams. I did buy a share of Sherwin-Williams stock, and we did go to the shareholders meeting. And part of that story is they basically said, the decision to make new lead paint, that's normal business operations. Shareholders do not have the authority to intrude on our normal business operations. We went to the Securities and Exchange Commission and they begged off. Frankly, they probably would have thrown us out of the meeting if it hadn't taken the nuns with us. We took some socially responsible nuns, and so they were forced to listen to us for a little while. But yeah, the industry still does not, with some notable exceptions. There are some paint companies around the world that no longer make lead paint. The world's biggest paint company, Axel Nobel, out of the Netherlands, basically said there is no good reason to put lead into paint today. So they don't make it anymore. And more that's happening. But there are some companies like Sherwin-Williams that continue to make it. And it's really something that we as a nation should respond to.
Another question, what are the lessons from lead that we should apply to other chemicals introduced into everyday products? How do we avoid repeating the same mistakes we made with lead in paint, gas, etc.?
Yeah, it's a great question. I think the bottom line is it shouldn't be left to epidemiologists to, figure out what new product has been entered into commerce and then study it to see if there's a health problem and then react. So some countries are moving to the idea that if we're going to put a new construction material into commerce, it should be tested up front to see whether it's off-gassing or producing some other toxicant, rather than wait for the evidence to roll in that people are getting sick from a particular product. So that's kind of the concept between healthy housing. This country, we still don't test most construction materials. There are some important voluntary standards that are coming online that would propose to do that. The Europeans do a better job of that than we do, but it's clearly something that we need to improve. And I think it's a critically important question. The key message of this book is we can't just keep reacting to sick people. We have to invest in health. And if we do that, we're smart about it, we can avoid some of these huge expenses and not only prevent suffering, but also save some important money and make the market work. Maybe I'll close with this quick thing. If you think about the three parts of our economy that are really screwed up, what are they? There's climate change, that's the big one. But there's also the housing world. We're still digging our way out of this affordable housing issue. And we're still trying to reform our healthcare insurance system. So housing and health go together, they're interrelated. And if we are smart about it and understand the linkages, we can make progress. So when we inspect a home, there should be a healthy housing inspection, not just a lead inspection. We should get the facts and then create policy so that we can act on the facts collectively as well as individually as homeowners and others. But it's been a pleasure to be with you today, and I hope we'll be able to talk some more about these solutions, not just today, but obviously in the decades to come. So thank you.